Hi, my name is Maura Van Bogart, and today I will be talking about syphilis. So what is syphilis? Syphilis is a systemic bacterial infection that's caused by the spirochete Treponema pallidum subspecies pallidum. It's a highly invasive bacterium that spreads throughout the body via the lymphatic and venous systems within hours. And it has a large number of potential clinical presentations. And because of the many symptoms that appear, they are similar to other common infections. Syphilis has been given the name the Great Imitator. So syphilis is a worldwide disease, and it only affects humans. And it's transferred by means of direct contact with associated sores during oral, vaginal, or anal sex. And it can also be passed from infected mother to unborn baby through placenta or by exposure to a sore during vaginal birth. So T. pallidum is a corkscrew-shaped gram-negative bacteria, and it has slender spirals and is actively motile around its flagellum. It's unable to survive outside of the mammalian host, and this inability of T. pallidum to survive and multiply outside of the mammalian host is the greatest impediment to syphilis research, and is why there's still not a lot known about its mechanisms. So the outer membrane of T. pallidum, it differs from most other gram-negative bacteria in that it lacks lipopolysaccharide, or LPS, which is an endotoxin that's found in most other gram-negative bacteria, and it causes fever and inflammation. Additionally, T. pallidum, it has scarce amounts of integral membrane proteins, and it's believed that this may allow the organism to evade the host immune response. So T. pallidum has a significant lack of metabolic capacities. So it goes through glycolysis, but it lacks the Krebs cycle and the electron transport chain. And it also lacks pathways for the use of alternative carbon sources for energy, and it lacks amino acid and fatty acid synthesis pathways. The generation time is also unusually slow in that it is about 33 to 36 hours is the replication time, and this is due to the fact that it only uses glycolysis for ATP production, and it lacks the enzymes catalase and oxidase, which helps detoxify oxygen, and it's very sensitive to the temperature and pH. So once T. pallidum it enters and it multiplies, it invades through the mucous membranes and epithelium. And from there, it disseminates to regional lymph nodes, and then it can be translocated in through the circulatory system. And after that, the inflammatory response it can be either localized and generalized, and untreated infections are then characterized by the different stages of the disease. So traditionally, there are 5 stages of syphilis that it's divided into, and that is acquired, primary, secondary, latent, and tertiary. And we're going to talk about each of these. So primary syphilis, it occurs about 3 weeks after exposure, or from 10 to 90 days. And a painless sore known as a canker develops at the site of where the bacteria entered the body. And from there, a regional lymphadenopathy can occur, and the canker heals on its own within 4 to 6 weeks. The most common sites for this canker to appear are on the penis, cervix or labia, the anal canal, or in the mouth. And it's highly contagious during this stage. These are some examples of what the canker looks like, and because it is painless and generally in regions that maybe somebody might not notice them, and it heals on its own, people probably won't go to see a doctor, and that's how the infection is able to persist. So secondary syphilis is about 2 to 12 weeks after primary syphilis's canker heals. And it's a result from the systemic spread of the infection. So when the treponemes replicate in the lymph nodes, the liver, joints, muscles, skin, and mucous membranes, and all of these places that it can replicate are far from the site of the primary canker. And that's because it travels through the body by means of the lymphatic system and the venous system. So it can really go anywhere. Skin and mucous membranes are commonly affected and characterized by skin rashes on the palms of the hands and the soles of the feet. Condylomata lata, which is a benign, painless, cutaneous manifestation, mucus patches, and generalized lymphadenopathy. So here are some examples of sores on the palms of the hand, as well as the mucus patches or condylomata all over the body and on the tongue. And these can be different in everyone, where it manifests, but most of the time a very diagnostic key is the sores on the palms of the hands and the soles of the feet, because that's very rare to see in other infections. So after secondary syphilis, latency begins, and that's after primary and secondary symptoms have subsided. But the infection is still in the body, replicating slowly, and it's divided into early latent syphilis, which is from the time of infection to about 2 years is considered early latent syphilis, and then if it's in late latent syphilis, it's 2 or more years. And the latent stage can be as brief as 1 year, or it can range from 5 to 20 or more years. And a person is considered non-infectious during this time, but it can be transferred congenitally. So next is tertiary syphilis, and this can occur about 3 to 20 or more years after infection. And it's responsible for the majority of morbidity and mortality that's associated with syphilis. And it's caused by the destruction of tissue, which can range from anywhere in your body because the treponeme is all over, can manifest all over. And the destruction of tissue is caused by a response to the presence of treponemal antigens. And there are the 3 most common forms are neurosyphilis, cardiovascular syphilis, and gummatous So neurosyphilis is the degeneration in the central nervous system, and common manifestations are meningovascular syphilis, general paresis, or tabes dorsalis. Meningovascular syphilis, it's when the arterial walls or cranial nerves and meninges are affected and they become inflamed. And this can lead to strokes or heart-related conditions like obstruction to blood flow, ischemia or occlusion, heart attack, or blood clot formations. Paresis is another type of neurosyphilis, and that's when the cranial nerves and meninges are affected and they become inflamed by, and it's caused by chronic meningoencephalitis. And it results in symptoms that are very similar to dementia, and as it progresses, it can develop with psychotic symptoms. A great example of this, it was in Al Capone, the notorious mobster, and he contracted syphilis around the age of 18, but it went untreated, and it wasn't until he was in jail in Alcatraz that he really started to degenerate, and the doctors of the prison basically said that by the time he was released, he had the cognitive capacities of a 12-year-old. So the third common type of neurosyphilis is tabes dorsalis. And this is a slow progressive degeneration of the dorsal column and dorsal root of the spinal cord. And it also can affect the pupilomotor structures of the eye. So the progression of tabes dorsalis can result in the impairment of position and vibration senses and damage to the optic nerves. Argyll-Robertson pupils are when the pupil is small and irregular and it accommodates but does not react to light, which can be seen in the image on the left. Trophic lesions, such as Charcot's joints, are progressive degenerative disease of the joints, and they can be caused by nerve damage. And distal extremity neuropathic perforating ulcers, which is seen in this bottom image. Charcot's can lead to this, and it's basically local lack of sensation in the foot over pressure points leads to extended trauma, and eventually it ulcerates, and underneath this, the thickness of like the callus is infection and bacteria, which then can lead into the bone. And this is very commonly seen also in diabetes mellitus. So cardiovascular syphilis is characterized by aneurysm of the ascending aorta, aortic regurgitation. Aortitis is the most common manifestation, and aortic valve insufficiency. And in this image is an example of a large aneurysm involving the distal descending aortic valve. So the third type of neurosyphilis is gammatic and a gamma can develop between about 1 and 40 years after healing of the secondary syphilitic lesions, and it's characterized by the development of soft tumor-like gamma lesions. And most commonly, they manifest in the skin, liver, seen in this image up here, in the bone, that can be seen here in the hard palate, as well as this image of a World War I era. The gumma with the T. pallidum, it eats away at the bone, and you can see just the devastating destruction of this bacteria. So congenital syphilis is when a pregnant woman that has syphilis she can transmit T. pallidum to the fetus through the placenta. Additionally, if a primary canker is near the vaginal canal, as if she's giving vaginal birth and the baby is exposed to it, the baby can also contract congenital syphilis, but most commonly it's through the placenta. And some infected fetuses die and miscarriages result, while others are stillborn at term. And so it's about 70 to 100% of moms in primary syphilis is the rate of transmission, while 40% of transmission for early latent syphilis and 10% for late latent disease. So basically, the longer the interval between infection and pregnancy, the more benign the outcome will be for the child. So earliest manifestations occur within 2 years of age, and the children are very infectious, and they can suffer from the snuffles or persistent rhinitis, and the mucus and blood that they produce is very infectious. And they have the macular papular rashes, as you can see in these images, on the soles of the feet and palms of the hand, as well as bone changes and lesions. So late congenital syphilis, it occurs after 2 years, and it includes Clutton's joints, the Hutchinson's triad, which includes interstitial keratitis, which is clouding of the cornea, peg-shaped upper incisors, 8th cranial nerve deafness, mulberry molars, saddle nose, which is like the depression of the cartilage here, saber shins, a short maxilla, and bossing of the frontal and parietal bones. So here in this image is the example of the short maxilla and frontal bossing. This is a molar that indicates the mulberry molars, and this over here is the saber shins. They call it saber shins because it looks like a saber from the side. And here is the peg-shaped upper incisors. They are very distinct. And this is an example of a saddle nose. So diagnosis depends on clinical findings, examination of the lesion material for treponemes, and or a serological test for syphilis. And penicillin and cephalosporins are the recommended first line of therapy. And ever since penicillin was discovered, it has been a game changer for syphilis. And erythromycin can also be used for those allergic to penicillin.